Happy Tuesday, Facebook friends. We are happy that you have decided to join us again tonight for our heart-to-heart session tonight. Once again, Arkansas Heart Hospital is delighted to bring you another great opportunity to join the conversation about our outstanding and comprehensive bariatric program. Tonight, we have a great lineup for you. We have Dr. Oscar Toledo, Dr. J.J. Tucker. They're both board certified bariatric and general surgeons. We also have a registered dietitian who can give us some great BMI hacks as we head into the holiday season. We've got Corey and Elijah, patients of Dr. Toledo and Dr. Tucker, who have graciously agreed to share their BMI journey with you tonight. So we are excited to welcome them. You know, tonight's all about the opportunity for you to hear from experts and ask your questions. So just drop those questions into the chat, and we will get to all that we can in the time that we have tonight. Also, when you drop in a question, we'll register you for a drawing for some fun Heart Hospital swag. So thanks for joining us tonight. Let's get started. First off, in the coveted hot seat tonight is Dr. J.J. Tucker and his patient, Corey. Corey, thanks for being here with us
You're
tonight.
Very welcome. Thank
Dr.
you for having
Tucker,
me.
I saw you in the office earlier today, so I know you've been hard at it all day. Thanks for coming out tonight.
Absolutely. Wouldn't miss it.
Appreciate it. So, Corey, you had your gastric bypass in February, correct?
Yes, ma'am, last year.
So that puts you about
Or this year.
this year?
Yeah, this
So
year.
it puts you about 9 months out?
Yes, ma'am.
All right. So I think we have a before and after photo up there. And I'm going to ask you the question that you probably get all the time. How much weight have you lost?
I've lost right at around 125 pounds.
125 pounds. That's pretty impressive. So, but I think I have an even more important question for you, Corey.
Yes, ma'am.
Why? Why did you choose to look at bariatric surgery as a solution?
Well, it was almost a year. It was a little over a year ago. I was having chest pains. My wife brought me to the heart hospital here. They checked me out, told me I needed to go see Dr. Lindell, and didn't pass a stress test.
Oh, no.
And he told me at that time that I didn't have quality years ahead of me in at the position I was in, and that I was 53 at the time, and he said I would really be lucky to see 60. And he said that it would probably be beneficial if I went to see the team at the Encore Center and the BMI Center, and I did. He set me up with Dr. Tucker, and I went in, and my first visit with Dr. Tucker, it was just, we hit it off really well. He understood me. He understood the position I was in, and really just wanting to be a family man and have a life with my grandchildren, my kids. And he set up a plan for me. I went home, talked to my wife, got back with him, and we decided that I would have the bypass surgery. And we went from there, and it's probably the best decision I've ever made.
Okay. Now, you mentioned that you had the bypass surgery. So, Dr. Tucker, why was the bypass surgery a better option for Corey than the sleeve, which we do more of?
I think this is always the question we really get down to in the office, and it's really which one is best and most suited for the patient. Both operations have tremendous outcome. They have great outcomes, and there are some subtle differences very specific to what diseases you have. And I tell people, and then you have to prioritize it. You know, I say, my priority number one is I don't want to have insulin-dependent diabetes. If that is your penultimate goal, then we talk about, well, I think maybe a bypass would be better. If you have hypertension and sleep apnea and high cholesterol and you're relatively active, and I'm like, hey, I think maybe in your situation, maybe the sleeve would be the better option. And we kind of go through those scenarios, right? I always call it we call it the risk benefits portion of our office visits. Say, hey, every decision we make, this is the benefit of what this operation offers. Here's some of the things that we could maybe expect because of surgery to happen, and we say, okay, which one are we most comfortable with? Which one fits your idea of how you want this to go best? Okay, and then we decide on that and kind of go through it, and then we work towards that goal.
That's great. So, Corey, tell me about your recovery. So, once you had it done, pain levels, time before you were back at work, what kind of things?
My pain levels were not near as bad as what I thought it was going to be. I ran through a few bumps in the road and all, but I was back to work simply because of the type of work I did. I had to stay out for about a month because they required that I had to go back at 100%. Then I had a few problems, and we got those worked out. But just after the bumps in the road, everything mended well, and that's when I really started the recovery, and I started losing weight really fast, faster than I ever imagined I could, and started feeling better than I thought I could. That's what I tell my friends. I said before I was 53 and I felt like I was going on about 85, and now I'm 54 and I feel like I'm 30 again.
Oh, look what you've created here.
Well, that's what we love. I tell people, patients are so happy. The most rewarding part of this is patients come back and, you asked at the beginning, how much weight he lost. And, that's rarely ever a question that comes up. And I tell patients, because that's not the relationship. I say, how do you, we ask about feeling healthy. How do you feel? What has it allowed you to do? Because I tell you that's patients are so excited. And they come back in and they're just beaming ear to ear when things are going as we like, and say, but they just can't wait to tell you a story. You just sit there and wait, because they're not going to tell you how much weight they lost. They're going to tell you what they did. And I think that's kind of what people understand is that's where people think, oh, it's a weight loss surgery. It's really not. Okay, I mean, this is a surgery to get healthy. This is a way to address health concerns and consequences of less than perfect health. And when the patients, again, oh, great, I feel 20 years younger. Well, I wish I did. I'd love to feel 20 years younger. But I bet patients, most people don't understand the situation. The patient, they've never been 40 and just felt like they're absolutely run down. They're 60 years old. They're super tired. They just want to live a normal, and active, healthy life.
And you are, aren't you?
I
you
am.
Are.
I'm
so,
very healthy now.
Rumor has it that you have a new granddaughter.
Absolutely, yes. I'm so excited. She's going to be here in 2 days to visit from Florida.
That's so nice. Now, does she have you wrapped around her little finger yet?
Very tight.
I'll bet. So, how did mentally, so Dr. Tucker mentioned that we want our BMI patients to look at this, and we know they do from the health perspective. Physical health, what about your mental health? How was that impacted as well?
It absolutely was. I had gone through some mental problems before, and I think a lot of that was associated with the way I felt, the adversity I was facing in life with getting up every day and having difficulty really making it through the day like a person should be able to make it through. And now, since I've gone through the gastric bypass, it's just every day now, it's just I wake up ready to go. I'm a much happier person. I feel like my life is much more fulfilling now.
That's great. So we know that this change is lifestyle long term.
Absolutely.
What's been, twofold question, what's been the hardest thing about that? What's been the easiest thing about knowing you're making a change for a lifetime?
The hardest thing was at first just getting yourself to get it in your mind that you were going to make a complete lifestyle change. Once you start making that change and it becomes everyday life, then it's not so bad. It's the food, you find out that, as Courtney, my dietitian, had told me, you find out that healthy food is good food, and now it's just, I love healthy food. It's I can see the commercials on TV with the cheeseburgers and all, and it turns my stomach because I can't handle that type of food anymore. But you learn that food-wise, you eat 8 ounces and you're just as full as you were when you would eat 2 to 3 pounds of food before, and you're just as comfortable and you're just as satisfied. So that makes it easy. I still love food. It's just I go with smaller portions.
Well, there you go. There you go. So, have you been involved with the BMI Facebook support group?
I have.
Tell
I
us
have.
about that.
I enjoy it. I go on. I try to respond to a lot of people that put their before and after pictures because I enjoyed that, getting response from people, and it's very encouraging.
Yeah, it is, isn't it?
When you see, because in the beginning when I first started going on, I started wanting what they had, and now it's, people will tell you, they'll comment on it, and they'll tell you that you're an inspiration for them. It makes it all well worth it.
That's great. So, Dr. Tucker, this is Corey's first season heading into Thanksgiving, so navigating the holidays. What do you think, what's your best advice to give him?
I tell you, when you go into the holidays again, culturally we love to surround ourselves with food. It's when we're celebrating a newborn grandbaby, right? We're celebrating a promotion. We're celebrating graduating college. It's birthdays, it's anniversaries. And especially in these holiday times, we surround ourselves with food and family. We congregate around there. And one of the things we did at our house years and years ago was we kind of challenge each other to say, hey, let's maybe kick the tradition a little bit. How about you take a dish and find a way to make it healthy? It's like, okay, I was left. I think green bean casserole, right? Yeah. It was the first time that year that, we did like some prosciutto wrapped bacon bundles with like a balsamic reduction, right? We still had green beans, right? We still had the traditional things, but it was okay. Hey, listen, let's maybe change it up a little bit. Let's find ways to maybe include some of these more traditional meals, but let's not. And the whole family did this, and it'd be kind of because again, we're trying to foster a healthy environment for our children and things, because nutrition has to be taught. Okay. And I do think that's something that we sort of neglect in just everyday conversation with our own family, with our own children. I think maybe even in school. I think that people don't really have a real understanding of how to create and maintain a healthy nutritional lifestyle. And again, not to people, like Corey said, good food doesn't have to taste bad. There's a lot of wonderful, healthy food out
Absolutely.
there, and there's really no limit to the ways you can put it together and create meals and always have that variety and that enjoyment, and still get to celebrate with your family and friends, especially on the holiday time.
So Corey, would you do it again?
I would do it again in a heartbeat. If you take the way I felt beforehand when I was 300 pounds plus, and now at 180, the way I feel now, it's just different as night and day. I would do it again in a heartbeat.
Well, we are thrilled for you. You look wonderful, but more than looking wonderful, I can just tell in your demeanor and your face that you are healthy, you are happy, you are moving forward, and you're enjoying life.
Oh, very much so.
And I love that. I love that. Well, thank you for spending some time
You're
with
very
us
welcome.
tonight. I feel certain that you've inspired someone out there tonight who's kind of been sitting on the fence about what they want to do or could do, and so you've painted them a wonderful picture of what could be, and so we thank you for that.
Thank you.
Dr. Tucker, we'll see you again in a little bit. We're going to take a break, and so I want you, our audience, to stand up, stretch your legs, take a few deep breaths, and we'll be right back with Dr. Toledo and his patient, Aaliyah. So come on back and join us in just a few minutes.
What is the Bariatric and Metabolic Institute?
It's the only place like it in the region.
Where our comprehensive team comes together
to provide weight loss surgery and support.
BMI is home to surgeons, dietitians, psychologists, and more.
All backed by the strength of Arkansas Heart Hospital.
So patients can lose weight,
have healthier hearts,
and better lives.
Encore is our second act. Let's get started on yours.
Actually, I enjoyed eating and drinking wine and having a great time at 200 plus pounds, and I needed a hip replacement, and the doctors were afraid to do it. And I went to Dr. Bledsoe, and here I am today, many, many pounds lighter, enjoying life, have my life back. My practitioner told me that I had bought at least 10 more years, so I'm very happy. Dr. Bledsoe is very easy to talk to. He explained everything thoroughly to me. Oh my goodness, I have so much more energy. And you know, I've had joint replacements and had a lot of pain associated with that just losing the weight has helped me tremendously. It's helped me at least be able to go and exercise now. A lot of people who are thinking about doing this procedure will ask me, or say, I don't really want to give up my life. I love eating, I love cooking. And I say, well, you know, I can enjoy the same steak you do. I just eat so much less now, and I'm just as satisfied. The BMI team, all of them are great to work with. Yeah, from the nutritionist, Courtney, that I met with, the ladies who work there in the office, everyone was just so helpful and helped me feel comfortable about the journey I was about to venture out on.
Welcome back to Heart, brought to you by Arkansas Heart Hospital. I hope you got up and moved around a little bit. You know, movement is good for your body and your mind, isn't it, Dr. Toledo?
Of course it is.
Of course it is. So joining me for the next few minutes is Dr. Oscar Toledo. Thank you, sir. And his patient, Aaliyah. Thank you for coming out and joining us tonight. We appreciate that. So, Aaliyah, I'm going to start with you first. You're about a year out?
Yes.
Is that correct? And I think we have a before and after photo on the screen as well. And just like I asked Corey, I'm going to ask you how much weight you've lost, but that's not the most important piece of the puzzle. So after you tell us that, then I want you to give me your why.
Okay. So I have lost about 125 pounds.
Wow.
Yeah, it has been a long journey.
Yeah.
But the main reason why I wanted to lose weight was it was just affecting my life.
Okay.
I remember I went to an amusement park with my family, and I got on a ride, and it was pretty hard to fit on there. And then I went and ate lunch, and I tried to go back on this same ride with my sister, and I could not fit on it. And I had to just kind of have that walk of shame off, and that was really hard to deal with. Yeah.
So doing things with your family were becoming increasingly harder.
They were.
So it was time to see what your options might have been?
Yeah.
How did you come across our program?
So I actually did a lot of research, and the Arkansas Heart Hospital was a brand new state-of-the-art hospital with the best doctors in the state. So
Still
it really
have the best doctors, don't we?
Yeah. It wasn't a hard choice. I knew that this was where I wanted to go.
Well, good. So tell me about what the process has been like once you made that decision and had your surgery. Walk us through a little bit about what that's looked like for you.
Okay, so starting out, I remember I did an online seminar. Wasn't hard. And then I made a consultation appointment, and that's where I got to meet my nutritionist, and I got to meet Dr. Toledo. And at that appointment, we kind of discussed our different options and which route I wanted to go, and ultimately we decided on the gastric bypass.
So you also did the gastric bypass?
I did.
Okay, good. So I understand that you struggled for a little while with PCOS.
I did.
Polycystic ovary syndrome for quite a while before surgery.
Yeah.
So how has this surgery impacted that condition?
Oh my gosh, so much. I mean, my symptoms are non-existent. I remember when I got diagnosed with PCOS, my doctor told me I would face a lot of infertility problems. And since then, after surgery, I had a doctor's appointment, and my doctor told me I would have no problems at all. And I was just so happy to hear that, because I know that in the future I want to have a family.
Right.
So that was really important to me.
That's pretty cool. That really is. So Dr. Toledo, to that point, we know and we've seen, and we've got patients sitting in front of us that we've seen the impact that the bariatric surgery has made just on that piece of the health. But what about other things like PCOS or other what are some other things that we might see some impact on with regard to having surgery?
Well, the surgery impacts so many other diseases that are related to obesity. Among them, we have hypertension, diabetes, reflux, sleep apnea, PCOS, infertility. And the list goes on and on of all these things that we can make better, or cure even,
Right.
or completely cure. It is not. It is pretty often that our patients immediately after surgery are able to decrease or go off completely off their medications for certain diseases, even without having lost a pound.
Wow.
Because the surgery has impact on some hormonal cascades inside of the body, and that affects the diseases as well. So it is a pretty great surgery to perform in people because you can see the effects of it throughout their journey, at the beginning, middle, and throughout their life.
Right. So how has this impacted your long-term lifestyle?
Oh, I mean, before I would walk up a flight of stairs and I would be out of breath. Now I'm walking like 6-7 miles every day and I'm able to move around. I have so much more energy. Like before, I wanted to focus on my health before I could think about like furthering my education. And now that I've got my health under control, I'm able to do things like work full-time and go to school. And I never thought that I would be able to accomplish these things.
Wow, that's quite a lot going on for you. What if there's someone sitting out there tonight saying, I am just not sure what I want to do, what would you tell them?
Oh, I would tell them to get the surgery, 100%. Look at all of your options, and they have great options here at this hospital. I would do it over again if I had the option.
And it's more than just about losing pounds.
Yeah.
Would that be a fair assessment?
Yes.
Okay. What's been the most meaningful part of the program for you?
I would say just gaining my quality of life back, being able to do the things that I wasn't able to do before, getting to spend time with my friends and my family and just be more active.
Did you have the pain levels and things, and how long before you got to go back to work?
My pain was minimal. I think the first couple of days it was a little rough, but after that it was great. I was up and walking around, and as far as work goes, I was able to go back to work within a couple of weeks, 2-3 weeks, I'd say.
Well, that's good. That's not bad. What do you do now with your family that you couldn't do before?
Ride rides. Yeah, no, I'm able to walk around, go to events, spend time with my brother.
Nice.
I wasn't able to do those things before.
That's so cool. Do you meal prep?
Yes, I meal prep all the time. Not all the time, but most of the time. I like making like just little meat and cheese trays and grapes, stuff like that, just more whole foods.
Yeah, like your own little custom Lunchable. Huh?
Exactly like
That's
that.
nice. So do you, when you go to like this, you're coming through, I think this will be your second holiday season. We talked a little bit before.
Yeah.
And you said the first one you were right out of surgery, so it was a little different.
Yeah.
So are you going to modify recipes this year, or how will you handle the holiday season?
So we'll still be able to keep it a little traditional. We'll have the ham, we'll have the turkey, but we'll be changing some stuff around. Like instead of having mashed potatoes, we're gonna have cauliflower mashed potatoes. And you can get a lot of great recipes off of Pinterest or even in the support group. A lot of people post great recipes in the support group.
So the support group's been great.
Oh, it's been so helpful.
When I visit patients over at the hospital, I always ask them, have you logged in and joined the BMI Facebook support group? And everyone says yes, and how before they've even had surgery, they're getting tremendous support from people encouraging them and helping them along the way. So that's really a unique and wonderful piece of what we get to do.
It is.
What is the one thing, Dr. Toledo, when you are counseling, someone comes in for their very first consultation, what's the most important thing you think you need to communicate with them at that time?
The changes in their lives and the alternatives, risks, and benefits. So the full medical and surgical disclosure of the procedure, I think, is the thing that I am most intense about getting across. Full disclosure of what is going to happen, how is it going to change, what are the risks, and what are the benefits. And also, what are the risks of not having the surgery.
Oh, yeah, that's the piece of the puzzle that we don't often look at. Is what happens if I don't have this surgery?
Because, I mean, people might approach the decision as if I undergo the surgery, there are surgical risks. So, meaning that if I don't undergo the surgery, I have zero risks. That is true, but that is not the entire puzzle, like you just said. If you remain obese and with all these comorbidities, there's an intrinsic risk of just the status quo, like just remaining the same year after year. So that has to be brought to their attention as well.
What's a good candidate? Who makes a good candidate for this surgery?
Anybody with a BMI, a body mass index above 35, and comorbidities, or a BMI of above 40 and no comorbidities. When I say comorbidities, I mean associated diseases to obesity, like hypertension, diabetes, reflux, sleep apnea, the things that I mentioned earlier. Them with the intention of changing their life and habits. Non-smokers, very important, you know. But the thing is, we'll help you get there. If you have the will and you qualify, we'll help you overcome any other, you know, problem or health issue that you might have.
Absolutely.
So it should not make you restrain yourself from coming in. Sit down for the appointment, ask you the questions, we'll guide you.
Yeah, good deal. So, Aaliyah, I would ask you the same thing I asked Corey. Would you do it again?
100%.
100%.
Yeah.
That's awesome. That's awesome. What is the one thing, if there's someone out there sitting on the fence today, what would you tell them? What would you share with them?
I would tell them that this is a great option and that it has worked for me and it has worked for so many people out there. And like I said, if I had to go back, I would do this all over again, the entire process, because I'm just going to live a long, happy, and healthier life.
I think that you absolutely are going to live a long, happy, and healthy life. Good deal. So, Dr. Toledo, what would you say to Aaliyah moving forward?
Good job. That's the first thing that comes to mind is she won at this game. You know, she absolutely won. And after hearing, you know, a little bit about her life and her objectives, so you have goals that you are meeting, which keeps you going, and you're doing the meal prepping, and you're walking like 7,000 miles a day. I'm paraphrasing. You know, it's this is the recipe of somebody who's gonna succeed long term. You know, because after the surgery is all about the patient's will of doing things right, dieting and exercise and having healthy habits, and you're checking all the boxes. So,
Thank you.
I like that. That's good. Yeah. That's great. Well, we have got more to come, and so if you want to go ahead, we're going to take another quick break, and go ahead and grab a snack. A healthy snack. I'm going to ask you what you had when we come back, so make sure it's a healthy one. And then we're going to talk to an amazing, dynamic duo that you are not going to want to miss. We're going to bring Katie and Courtney up here. You have some great questions for them, and you're going to enjoy what they bring to the table. So, come back soon.
Why would our second hospital focus on bariatric surgery?
Encore Medical Center is home to our Bariatric and Metabolic Institute,
where we take a whole new approach.
Losing weight for heart health.
Here, we help patients reach their weight loss goals, reverse diabetes, and improve their quality of life.
Encore is our second act. Let's get started on yours.
So I'm Taylor. I had bariatric surgery. I had the vertical sleeve gastrectomy, and I have lost 225 pounds. Before, in high school, I was really involved in softball, and then all of a sudden I just started gaining a ton of weight and had to stop because I was having really bad heart problems. It was my junior year or sophomore year of college when I decided to have surgery. And ever since then, it's been a life changer. I have so much more energy. I can go out on hikes or walks and not worry about, am I gonna get tired? Am I gonna be able to make it through? So it's been incredible. I've struggled with being overweight my whole life. Being able to do it at such a young age gave me the confidence and the courage that I needed to succeed in life. Dr. Bledsoe is an amazing doctor. He never made me feel judged or uncomfortable. He wanted to make sure that I wanted this in every way possible and that I was doing the right thing for me because I was so young. The BMI team is absolutely amazing. They are always there. When you walk into the clinic, it feels like family. It feels like home. Everyone is so encouraging and so motivating, and it's unlike any other doctor's office I've ever been to.
And we're back, and you can tell me in the chat what kind of healthy snacks you had during the break. Be honest. Wink, wink, nod, nod. So I have Katie and Courtney from our BMI team at the table, and they are ready to continue the discussion tonight. Thank you guys for being here.
Thanks for
It's always
having
a
us.
pleasure to run into these ladies in the hallway, and then in special things like this when we can kind of pick their brain about all the very cool things about our BMI program. Courtney, I'm going to pick on you first.
Okay.
And I want you to tell the audience first, before I turn this over to her, I want you to see passion in action here. This girl loves what she does, and she's amazing at it. Courtney is one of our registered dietitians, and they are an incredibly important part of our program. And so they talk with you. They're there for you every step of the way. Your ups, your downs, your plateaus, your I don't get it. All the above, all the above. So, Courtney, tell me about the nutritional support our BMI patients receive. What do we provide?
Well, when we first meet with our patients, we kind of go over their history, what things that they like, what things that they don't like. But I feel that the most important thing is to kind of take that concern of, I'm not going to be able to eat anything that tastes good anymore. So many of our patients, that's their biggest concern. Okay, here comes the chicken and broccoli talk. And I'm like, yeah, chicken and broccoli is good, but there's so much other good stuff out there. And just, opening their eyes to all the really good food that's out there. And so, they have access to us all the time. Myself and Shannon, our other dietitian, our Facebook support group page, which I know I'm biased, but I think it's a fantastic resource for patients. We have lots and lots of recipes on there. We have our Facebook Live. Patients can, interact with us on that. And then, of course, we have our HIPAA-compliant Helo app that patients can also, if they want it to be a little more one-on-one. So we're there. I tell them it's a lifetime relationship. They're stuck with me.
Well, I can think of worse things to be stuck with. Did you, Katie?
Absolutely.
Really good. So the holidays are here, and we are all going to be having to navigate family dinners, office parties, special treats. So how do you help your BMI patients work through times, holidays, and seasons like this?
I think the most important thing is, go in with a plan. You don't ever want to go to the grocery store hungry. You don't ever want to go to a holiday party hungry. So, go in, have an idea, okay, this is what's going to be there. You can always offer to bring things that are, low carb but still taste good. Be okay with telling people no thank you. You're gonna have people that are pushing food at you. You're doing great with your weight loss, one bite won't hurt. Well, it might, if one bite's too big, it could be uncomfortable. And, patients have put a lot of time and effort and hard work into this, and, being okay with saying no thanks and being okay with that.
I have some friends who have pretty severe food allergies, and they have gotten to where they just take their own snacks unapologetically. And you know what? I have yet to see a hostess be upset or angry. So I think we need to give people permission to if you've got an allergy or something, take your own snack, and we as hostesses will promise not to be offended.
Well, and volunteer to bring the charcuterie board, right?
Yeah.
And so that you know that you have options at a party you're going to.
That's a great idea. That's a great idea. So, for many patients, and we asked Aaliyah, she said that she did, they meal prep. How important does meal prep become?
I think meal prep helps take the stress out of the week. And we think of meal prep as we've got to go spend all this time, number one, at the grocery store shopping, then we have to come home and cook it all, and then we've got to break it all down. But there's so many time-saving tips. I mean, we love rotisserie chickens at BMI. We talk about them all the time. But there's, pre-cut, pre-washed veggies. And again, we've got meal prep ideas on our Facebook page to help patients with just keeping it simple. I think is the most important thing. Don't overwhelm yourself. And if you feel overwhelmed, we're here. We're happy to help.
I think that we do that to ourselves a lot. We just make it more complicated than it is, and there's so many tools out there for us now. It seems like that should be an easier thing to do. Courtney, we had a question from someone who had surgery done in 2017.
Okay.
Did really well, lost almost 200 pounds, and maintained right around that 200 marker for a couple of years. And then now they've kind of crept back up to 265. And their question was, how would you advise me to get back on track? What do I need to do to get this back to where I need to be?
Again, keep it simple. Back to basics. Your proteins, your non-starchy veggies. Make sure your food tastes good. And when in doubt, reach out to us. That's what we're here for. If you're in the middle of an ocean and you feel overwhelmed, you need that life preserver. You don't just want to sit there and tread water. That's why we're here. And that's one of the things I love about our program is we're always here to help.
And like Courtney said, this is a lifelong relationship. So, obesity is a chronic disease, right? And so we're here for the good and the bad. So when someone's struggling, and come see us. Don't be afraid. This is what we do, and this is what we're here for. So make an appointment. Come see one of our surgeons or one of the APRNs or PAs, and then come have a sit down with Courtney and Shanna, and let's get you back on track.
Yeah,
that's when you need us the most. Is when you're struggling, and that's why we're here.
Yeah, I think one of the neat things, it's not just the two of you, they've got access to the doctors and they've got access to the other staff. And I think that's a really unique property of what we are able to offer our patients. So Katie, now for you in the audience, Katie is an RN and she's the director of our BMI program. And she was actually part of the team that dreamed and built this, our Bariatric and Metabolic Institute. And the founding physician in that team had a really specific vision for helping those who find themselves in unhealthy circumstances caused by obesity that seem insurmountable to be able to climb that mountain and get through it. And so they continue to offer to our patients an amazing program. So Katie, I want to talk logistics with you because you know that piece of the puzzle so very well. What are the qualifications for surgery?
So the qualifications for surgery, like Dr. Toledo mentioned, is usually a BMI over 40 or a BMI of 35 with a comorbid condition. That's in order for insurance to cover that. There are some qualifications where we can go down to a BMI as low as 30, but that's not usually covered under with your insurance policy.
So insurance can be a pretty tricky thing. So how do we help people around that navigate that whole insurance issue?
Insurance is the most complex thing about what we do. So we have an entire team that's here to navigate that process. So from the minute, just like Aaliyah talked about putting your information in online and watching that online seminar, when you do that, your information comes straight to our team, and we're going to contact your insurance, and we're going to go over and find out what your benefits are. Do you have benefits? What is your out-of-pocket? What qualifications do you have to meet? How many, do you have, certain weight management visits? Every insurance is different, but our team looks at your specific policy, and then we'll give you a call and go over that. What do you need to do to complete our program? What does your insurance require for you to do? And what is that going to look like for you? What is your, every patient also is going to be different as far as their plan. What is their deductible? What is their out-of-pocket max? And we calculate and we help, we take that step away or do that step for the patient.
That's amazing, and what a gift it is to people to not have to try to figure all of that out on their own. It's so confusing, just on normal insurance, much less something that's got a lot of.
It's confusing for us often in the office, so I just can't imagine for someone, to pick up the phone and contact their insurance company how to sift through all that information.
So, Katie, we've got some vacation, spring, it's not spring, Lord have mercy. It is Thanksgiving and Christmas. So with that, there are a lot of people that are going to have some extra time off and coming to the end of the year. Is it possible to get a consult, talk to someone, figure out what to do, and have that surgery done in a limited time frame?
It would be really hard right now, sitting at mid-November, to have that done by the end of the year. But right now is the perfect time. Don't wait till January, right? Let's go ahead and have a plan in place for January of how you're going to start your new life, right? Like you said, many people are off over the holidays, especially teachers and people that work in school districts. Now is the time. Put your information in. Let's get you in for a consult, and then now we've got a care plan and a way to get you healthier for 2024.
So in the consult, let's say I just don't know. I've done the research, I've looked out there, but I just can't make up my mind. I'm kind of one of those people that's kind of got to do this to things. So could I just say, can I just come in and meet you and talk to you and then decide? I don't have
Absolutely.
to make a decision.
So there's no, we have a lot of patients that may come into their consultation thinking they want one procedure or the other, but our team and our surgeons are going to sit down with you and look at your medical history. If you had abdominal surgeries, are you a diabetic? Are you, do you need to lose 200 pounds? Is there one procedure that might be better over the other? And oftentimes there is maybe one procedure that would be better. And sometimes either procedure is fine, and so it's the patient's preference at that point. So, but there's no pressure. Come in, let's talk about it. We have patients that sometimes just that initial consultation is all they need to feel more comfortable. I think Corey talked about the minute he met Dr. Tucker. Right. He knew immediately that he was in the right place. And, Aaliyah did her research online and knew already that our program was right for her. But come in, I think, you hear patients say it all the time. When you come into our office, it's unlike any other. We're all here it's a really happy and upbeat environment. And you often see a lot of celebration going on in the hall because it's all about making positive life changes. So come in, talk to us, and don't feel pressured, but let's learn more about the surgeries and our program and see if it's right for you.
And we love making positive changes and impact. So now Courtney travels with visual aids. So I'm going to let her explain. First, I'm going to ask you, what is the question you get asked the most?
Oh, that's a good one. There's so many different ones.
So many different ones.
Do I have to eat just chicken and broccoli? I mean, can I still eat food that tastes good? I would say that is the number one question, because people have been told it can't have salt. If it tastes good, spit it out. If it tastes good, it's not good for you. And I would say we're pretty much a foodie group at BMI. We love to talk about food. We love to cook it. We love to, share recipes and taking that concern that you're not going to be able to enjoy food anymore. Katie loves to say, "Hey, here's a recipe. Fix it. Make it friendly for everybody." And I love that aspect of my job, but also kind of giving people the visual of how am I going to go from eating a certain volume of food to how 4 tablespoons going to fill me up. And that's why I always travel with baby sleeve and baby bypass. It just really gives people that good visual aid of how it works. And it's also good for family members to see, because if they've never been around someone who's had bariatric surgery, it can be, kind of mind-blowing to see that small amount go in and have someone take a few bites and say, "I'm full." So
what is your advice, Courtney, for your patients who are out there heading into the holiday season? What was the one thing you would encourage them to remember and do and not sweat about?
Plan ahead.
Okay.
Grant yourself grace.
Yes.
It's okay. Nobody's perfect. If you have that bite, it's okay. I've had patients that say, I felt so guilty. I'm like, it was one bite of food. You know, it's okay. We're all human. So, and if you're really struggling with a recipe, throw it at me and I'll see what I can do.
Ah, she'll make magic.
Shanna and Courtney are really talented when it comes to recipes, and like Courtney said, often I'll see a recipe and it sounds really good, but I know it's not something that that we should be eating. So I'll give that to her with the challenge of how do we make this bariatric friendly. And you know, just this week I saw a patient post on our Facebook group that she was really nervous, had a lot of anxiety about post-operative eating, and now that she's on the Facebook group and took all weekend and sifted through the files and all the recipes, and she said, I know this is going to be okay.
Good. Katie, in our last little bit of time here, what would you want to say to someone contemplating bariatric surgery?
You know, I think the biggest thing that I would say is do it for yourself. You know, do it. Don't think about it just being about weight loss, but think about the people in your life that you want to be here for, that you want to enjoy quality time with. And, you know, the risk, you know, Dr. Toledo hit on this, but often the risk of doing nothing is so great. And like Corey said, you know, his life expectancy was pretty grim. And there's no doubt that he's added at least 20 years to his life. So think about the people you love. And think about this as not just being about weight loss, but being about living, and take that first step.
Living and living well. Well, as I promised, a dynamic duo for sure. We are fortunate to have these two on our BMI team, and I hope you get to meet them someday. So we're going to take our last break, and then we'll bring back Dr. Tucker and Dr. Toledo. So I need more questions. Ask me some questions, folks, so we can pepper these guys. We can't let them off the hook too easy, you know. And so with that, grab a snack. Well, don't grab
too much snacking, Vicki.
Too much
Too much
snacking.
snacking.
Water.
Hydrate. The dietitian has spoken. Hydrate, people, during this break, and we'll see you when we get back.
Well, I just had our youngest son, and I didn't bounce back like I did with our older ones. I was struggling really hard with being able to have the energy to keep up with my children and be able to be a great mom to them and interact with them. From the moment that I walked in, they made me feel as if this was something that I could do. I could actually have a lifestyle change. I could actually be healthy and live the life that I wanted to live, and not just something that is always going to be in the back of my mind that I wanted. And so I met with Dr. Fuller, and immediately it felt like it wasn't just a patient-doctor situation. It was more like a cheerleader. He wanted me to be healthy. And that right then and there made me believe in myself that this just isn't just another appointment. This is going to change the rest of my life. I love the fact that he is doing this with me, because I have a partner that I can look over, and he knows exactly how I feel on days.
It just changed my whole life, from the reception, from the nurse, from everybody. Every time I come in, they always happy to see me.
We love Courtney. The way that she breaks down nutrition and teaches us gave us a total different knowledge of how we could eat. And I love the fact that she is a lifelong asset. It's not just after we had the surgery, then she disappeared. She'll be there coaching us for the rest of our life. Once we checked out from surgery, they were committed to us just like we're committed to them in this journey.
Thanks for hanging out with us tonight on Heart to Heart. I hope you've enjoyed our guests. I have. I've met some very nice people tonight, and it's always great to get to see our doctors anywhere around the house or even away from the house behind a microphone. We appreciate you guys so much. So, Dr. Toledo, Dr. Tucker, thanks again. I know you're busy. I know you had a long day. So, Dr. Tucker, I'm going to start with you. I want you to talk to us about type 2 diabetes. So I looked at some stats in preparation, and 13% of Arkansans are diagnosed with type 2 diabetes. 36% are already diagnosed pre-diabetic. And there's another 100,000 or so people in Arkansas walking around who are diabetic and don't know they are. So those are some pretty dismal statistics. And November actually happens to be National Diabetes Month. So, and 2/3 of our cardiovascular friends will develop 2/3 of our diabetic friends will develop cardiovascular disease. So this is really a big deal for us in the cardiac industry, and knowing that what you guys do has an impact on diabetes. So talk to us about what the obesity and diabetes connection is.
The obesity, tell people, it rapidly accelerates a disease process, okay? Where, obviously you see patients can be diabetic and be of normal weight, but I would say that is kind of a low likelihood, okay? Patients who have some genetic predisposition or, family history, and those things, the obesity tends to accelerate the onset and to also accelerate the severity. And so that's really how it's kind of like adding gasoline to a fire, okay? And so it's not that one is directly going to cause the other, but if you have one, it's going to make the other one a whole lot worse. And that's sort of where you get the accelerated and early cardiac disease in patients, and you get accelerated and early renal disease in those patients, and all the complications that go with it. Just alone being diagnosed as a diabetic, you get an automatic yearly eye exam, you get an automatic for retinopathy and concerns about early vision loss. You get a yearly appointment to podiatrist because you're going to have wound healing issues. They tend to have a lot of problems with their feet, and so and even the patients, again, you're super concerned about on yearly visits to their doctor about catching their kidney disease early and kind of making sure that you manage those things in addition to just managing the diabetes.
So how does bariatric surgery help our diabetic friends, Dr. Toledo?
Well, there's been shown that the surgery itself interferes with a lot of hormonal cascades that the body has. So to put it plainly, it impacts our metabolism, which is a very big hit against diabetes. Like I said before, there is going to be weight loss and you're going to see an improvement of your diabetes as you lose weight, but there's also going to be immediate effects after you have the surgery, like the day after you have the surgery. You might be down on your insulin doses or on the amount of medications that you're on. And by doing so, you're getting rid of obesity and diabetes, and by doing those two things, you're going to get help with high cholesterol and cardiac health issues. So it starts, branching off and improving other areas of your health. So it's just wonderful.
There are so many things that this surgery can help us with, and we talked to Aaliyah a little bit about PCOS. And so I know that there's also the infertility piece of that. And so can someone go ahead and can there be a pregnancy after bariatric surgery?
Absolutely. Again, obesity directly accelerates the severity of PCOS, okay, and which is really the main driver for patients with obesity and infertility. And the recommendations are pretty clear that after it is perfectly healthy for both the mother and the fetus for pregnancy after waiting a minimum of 12 months. Okay, so once I tell patients, younger patients that are when they're concerned about whether they can have, and they'd have this decision, can I have can I get pregnant? Will I be able to eat enough for the baby to be healthy? And the answer to that question is yes, absolutely. There's no known increased risk at all after 12 to 18 months. We do recommend strongly, though, at the conversation that a patient have a form of protection for 12 months after surgery, a plan in place, because there is early in there's some risk for, I'd sort of say, lack of nutritional input, but not after 12 months.
Okay. Dr. Toledo, so what are some of the outcomes that a patient might expect? Things like how quickly, we know that we're able to send sometimes them home on lower doses of meds and sometimes even off their meds. How quickly would they begin to actually lose weight?
The very first week after surgery.
Really?
Yes. We have a very good program with a lot of assistance to patients. So after surgery, they go home with a very clear set of instructions, and then they come to see us at the 2-week mark after surgery and 6-week mark, and then 3 months, and so on and so forth. And we can start seeing weight loss at the 2-week mark.
Okay.
Actually, we do. In the grand majority of cases, start seeing weight loss at the 2-week mark, sometimes into 2 digits. So yeah, it is that fast.
What else could a patient expect to have happened in that first month after?
Well, like I said, improvement of lower weight, decreased amount of medication. And then one of the things that I hear a lot is how good they feel.
Okay.
And that goes into the amount of energy they have, the amount of strength they have, how they feel about themselves and their own skin. Because even if the scale wins are still not, like in the 50s, 100 pounds, they can sense slight differences of how their clothes are fitting them, or how they, so, and all these things are non-scale victories.
That is a great term. I've heard that in all the places when I go to visit out at the hospital, these non-scale victories. And they become actually, as I talk to people, those non-scale victories become more important than the pound victories. Yeah. And I think that's really, at the end of the day, really where we want to be. For you, Dr. Tucker, so we know that there's a lot of different ways. Well, not a lot maybe, but there are different ways to lose weight. What makes bariatric surgery the best way?
I think that it's the best way because it has the best long-term benefit, okay? We're kind of lucky right now. We have these new weight loss medications, which I think is great. It gives us more ammunition in this fight against obesity, okay? And listen, I tell people, like most things, medicine and surgery, they're always codependent, okay? When, one always helps the other. And, sometimes I tell people when medical therapy has been exhausted, that's when surgery has its role. Sometimes surgery has its role in the middle of that, in the middle of that scenario. And so, hey, listen, I always say there's a ceiling. The severity of obesity, because it's a disease, it is progressive by nature. And you can do diet and exercise and then pharmacotherapy, but at some point for patients, they hit a ceiling. And the severity of the disease is greater than that ceiling. And I think that's where surgery comes into play. When you've exhausted sort of medical therapy and you've exhausted these sort of lifestyle changes where it's just not controlling the disease anymore, hey, that's where surgery is. And, we talk about, you can talk about some of the newer medications and look, you may see reports of 15% of total body weight loss, okay? With surgery, the expectation is about 25, okay? And so, again, it depends in these conversations with patients, what is your primary goal? Do you want to, is losing 60 pounds going to cure your diabetes? Is it going to cure your sleep apnea? Do you want to throw that CPAP machine away? Okay? Because if you get to 60, it doesn't, then maybe it's the 90 or the 100 pounds that you need to lose, right? And again, it's just that bump, okay? And you get more of a a full effect of the hormonal changes. Dr. Toledo has used the word hormonal cascade several times, which is, again, goes back to these newer medications, which are synthetic hormones that we know that produced by the GI tract, directly involved in metabolism. And you get the full benefit. We're not talking about just insulin. We're talking about insulin and glucagon and somatostatin and, again, Wegovy, Mounjaro, these things. They're talking about GLP, which is a hormone. So is GIP, and so is ghrelin and leptin. But we see after surgery is that there is changes in the production of all of those hormones. Okay, I say there's about 10 to 15 named metabolic hormones. Okay, it's just the only two we talk about are the newer medications. Okay, but attacking all 10 or 15 hormones is way better than attacking one or two hormones.
What do you think makes someone successful? I'd ask both of you to answer this because you both see a variety of patients. What do you think makes someone successful once they've had bariatric surgery?
I would say habits.
Habits.
Yeah. You choose your habits. Habits determine your life. And I'm quoting that for a book. It's not mine. It's not my saying, but it stuck with me. You choose your habits, and habits will determine how the rest of your life will be. And that's why we have such good follow-up with our patients. Some patients could think, why am I seeing you at 3 months and then at 6 months and then yearly for the rest of my life? Why? I already know the things. And it's a valid question. I think that it is beneficial for their patients because we can reassure them on the things that that they're going through. We can bring them back to, hey, are you dieting as you should? Are you working out? Are you walking? Are you doing this? Are you doing that? Are you smoking? Stop smoking. All these things. So we bring them back. Sometimes we need that. So I would, if I had to condense it in one thing, what do I think is going to make a patient successful for the rest of their lives is their good habits.
That's a great answer. Thank you. What about you?
I think I always tell people, how are we going to immerse your lifestyle or in addition to this? Okay, there's nothing that we do at the office that's going to change your life. Okay, you're going to work, your kids, your responsibilities, your stress, right? But how do you integrate the changes into that life, right? What consistencies and what habits are we talking about that are going to make your new lifestyle work in your current world? Okay, and I think that's what makes patients successful, is their ability to not change their world, but to change the way they integrate food into their world and the way they stay healthy and active. And I think one of the misconceptions to that is that patients think that there's some severe, aggressive workout routine. And I tell people, it's really not. Patients really want to be active. Deep down inside, they just want to do all the things they want to do. Okay. And again, whether it's walking their dog, whether it's just, going up and down the stairs at work, whether people don't want to be worn out. They want to be the best version of themselves. And if they think the best version of themselves is playing baseball in the backyard with their grandson, and they can do that for an hour, that's what they want to do, right? And I say that's being active. It's just going out and doing all the things that make you happy, that make the people around you happy, and being that person for your family and for your friends. And that's what I remind them when we have these follow-up visits is, what are you doing? What is the impact you're making? And how are you making other people around you happy and healthy?
I know you guys hear countless stories of your patients when they come back in, that everything from glowing, I've never been able to do this before, or I'm back able to do this. We've seen them come back with 6 or 7 marathon medals. We've seen them say, I'm doing so many things. And like you said, or just playing with my grandkid in the backyard, throwing the ball. So what a wonderful gift to be able to give people. We are so delighted to be able to offer this program to the citizens of Arkansas. From Arkansas Heart Hospital's Bariatric and Metabolic Institute. We have an amazing team of people who are here to take care of you and to help you with these decisions. We can get any kind of information to you that we like. There may be a graphic on the screen that gives you any information you need. we're going to take this as a wrap for another heart-to-heart session. I've had very good company tonight. Thank you so much for all that you bring to the table. I see Corey still hanging out over there with us. Thanks for being here, Corey. I think Aaliyah had to leave, but we are so delighted that they were able to join us. And we'll hopefully see you again next time. Y'all come back out and play sometime.
Thank you.
Absolutely.
All right,
Thank you,
we'll
Vicki.
see you again. That's a wrap. Good night, everyone.